Okay, hello everyone. Welcome to this class on INI-CET recall. Okay, Ashutosh, Dr. Meghna, welcome. So, how was your exam, guys? Especially for those who have moderate. I saw the questions and I felt that they weren't really that tough. In fact, for anesthesia, let me tell you, most of the questions have been discussed for anesthesia. So I actually was quite surprised to see so many of the image-based questions that I've discussed with you all, and not just for the plus classes. It's also been discussed in special classes as well as YouTube. So I really hope that those classes were useful for you guys. And the pattern for NEET PG is going to be the same. So INI-CET and NEET PG nowadays, they have started working very parallel. They are going to have the same case-based scenarios and image-based questions, because that helps them to differentiate between the students who have seen the practical parts of their MBBS course versus those who are just going to read it from the book. Okay, so I've seen a lot of people have joined, Shimon, Pramita, especially I'm taking those names because I've seen them in my classes time and again. So I do want to have a review from you guys about if that is useful to you guys or no. And in fact, I got quite a few messages from many students saying that I had discussed some questions with them previously and that has come for the exam. So yes, anesthesia was good, because if you see in anesthesia, they've started moving away from the topics which are done to death, like which drug is contraindicated in asthma and which drug is given, or which inhalational agent of choice, and all that. They've moved from it towards something that is more important, like airway in COVID, and also the oxygen delivery devices. We had one such question today. Okay, so let's begin with our class for today. There are not too many questions. There are about 7 to 8 questions. And the first question was this: identify the position, Trendelenburg, reverse Trendelenburg, lithotomy, jackknife, lateral decubitus. Okay, so I've given you guys 5 options over here. And please answer only in the poll till I discuss the answers. This is just a quick half-an-hour class where we'll finish all the anesthesia questions. And what I also wanted to do here for you guys by bringing out these questions quickly is also to show you the other options, okay? Because now the pattern of questions is going to be around these questions that have been asked. So you need to know the options perfectly so that if they ask you in your NEET exam, you'll be able to answer them, okay? So 64% of you only have answered this correctly. So this was the reverse Trendelenburg position. Okay, a lot of you got confused whether it is Trendelenburg or reverse Trendelenburg. So whenever you have the head up, okay, it is reversed Trendelenburg. Please remember this. Whenever you have the head down, so if this is the position, then that is the Trendelenburg position. Okay, now in my next picture, I'm going to be putting different kinds of positions, and I want you guys to answer in the chat box what is what position. Okay, so we have, can anyone tell me what is A position? So I'll give you this because this is too easy. So that is supine position. So what is position B? So what you can do is at the end of the class, you can probably take this picture and you can keep it in your phone, and you can keep revising this. So you don't need to look anywhere else for position. Okay. Now his head is down, so it is Trendelenburg position. What is C? This is reversed Trendelenburg position. This was what was asked in your exam. Okay, head up, reverse Trendelenburg position. Now, if your patient is in D position, what is this? D is lithotomy, very good. What is E position? Okay, now in lateral, I want to know whether it is right lateral position or left lateral position, because they might give you the both in options. So remember, whichever is down, whichever side is down, it is that position. Okay, so if you see over here, this patient's right side is down. Okay, so this is right lateral position. Whichever side is down, that side is the lateral position. So this is right lateral position. Now over here, when you're breaking the table in between, what do you mean by breaking the table? You can see that there is an angle in the table. Okay, or they might keep a wedge over here in the just below the patient's body. Okay, so somewhere around the T10 vertebrae, if they just keep a wedge or a pillow over there, then this becomes a kidney position. Okay, this is used for renal surgeries so that there's easy access to the kidney. Now, same position like lateral, but if the patient's knee is up on one side, okay, if his knee is up on one side, then that is called as the jackknife position. It is usually used for anorectal surgeries. So that is one position that is not here. Okay. Then what about H and what about I? G is the same as F. They are both kidney positions because you're breaking the table in between, or you place a wedge over here. Okay, not between the legs, but you place a wedge below the pillow, below the T10 vertebra. Okay, F is prone position. Very good. And what is I? I is sitting position. Okay, now two more questions that they ask regarding positioning. Venous air embolism is the most common in which position? Anyone? Venous air embolism is most common in which position? It is in sitting position. Please remember this. Okay, and eye injuries are most common in which position? Eye injuries? Eye injuries? No, 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 no. Yeah, prone position. Okay, so eye injuries are most common in prone position. And one last question about positionings that they ask is compartment syndrome is common in which position? Yes, absolutely correct. So compartment syndrome is mostly seen in lithotomy position. Okay, so these are all your different types of positions. We have discussed all of them and all the complications related to these positions. So anything that will be asked in your exam will be on the basis of just this chart over here that I've put. Okay, so we are sorted regarding positions. With regards to your exam, this was the position and it was reverse Trendelenburg, head up or reverse Trendelenburg position. All right, next question. Identify the equipment. I have taught this on YouTube classes. I have taught this in airway equipment. I've taught this in revision of anesthesia. Okay, I've taught this in every anesthesia class. So is this, I got just three options over here. So nasal cannula, NIV or HFNC. Okay, so the fourth option was CPAP. So everyone who's attended my classes, I hope, especially this question, you got it correct because I have discussed this in every class that I have taken. I can see over here only 45% of you have answered it correctly. Yes, this was HFNC. What is the full form of HFNC? Shimon. Shimon has been coming for all the classes. So Shimon, what is the full form of HFNC? Or anyone who knows the full form of HFNC? You're not high frequency. Yes, absolutely correct. Shimon is correct. It is high flow nasal cannula. Okay. This is high flow nasal cannula, especially used in COVID patients. What are the other questions that you can expect about HFNC now? The first thing is, what is the maximum FiO2 that is given by HFNC? And what is the maximum oxygen flow given by HFNC? So anyone? What is the maximum fraction of inspired oxygen? How much percentage of oxygen can you give maximum through HFNC? No, not 60%. It is 100%. Okay, the maximum of FiO2 you can give through HFNC is 100% oxygen, and that's why it has been used so much in COVID. And the maximum oxygen flow that you can give through this is 70 liters per minute. Okay, now over here, what do you have? Parts of the HFNC, if they ask you, this is the flow meter. These are some special types of flow meters which can go up to 70 liters. Okay, and your normal flow meter can go only up to 15 liters. This can go up to 70 liters. Then this one over here is the corrugated tubing. Over here you have the nasal cannula which you put in your nose, and this part over here is called as the humidifier. So it humidifies the cold oxygen air that is coming from the flow meter, and it gives warm and moist and air into the airways. Okay. Okay, HFNC was not there. Okay, no, HFNC was one of the options. That is what I've got from others. Picture was not clear in the exam. Okay, but then you have to, okay, I'll give you another way of remembering. If they give you any kind of airway device with such big tubes, okay, and at the end of it, if you see nasal cannula. So if I show you over here, okay, see there is a big tubing coming outside from this humidifier. So this is the inspiratory circuit, and then at the end of it you will have two nasal prongs which go into the patient's nose. Yes, of course there is a zoom option, so I'll show you guys. So I've marked for you guys over here. This is the humidifier. This dabba type thing that you can see is the humidifier. This is the inspiratory limb of the circuit from where you get the humidified and warmed oxygen into the patient's mouth. Then over here, upper, what you can see is the flow meter. Okay. This is a special type of flow meter which has up to 70 liters of flow ka option, 70 liters per minute. Okay. And here you have the screen where you can see how much oxygen you have set, how much FiO2 and how much flow you have set. And here if you see, I'll just erase this. This is the part which goes around the patient's head, around his face. You attach it over here and it has two nasal prongs. Okay. So my picture is also not very clear, but this is exactly how you got it in the exam. So two nasal prongs are there over here, which you put inside, and then a rubber strap to attach it. Okay. All right. Now next question. What is the size of this IV cannula? So you guys, all of you should have gotten it correct. 16, 18, 20 or 22. Okay. Still here also 69% of you have gotten it correct. So this is, guys, please remember you have to know the color of all your IV cannulas. Quickly tell me the color of 16 gauge, 18 gauge, 20 gauge, 22 gauge and 24 gauge. All of them quickly so that we can revise all of them. 16 gauge is gray, very good. And I've missed one more, 14 gauge. 14 gauge is orange. 20 gauge is the answer over here. It is pink. What is 18 gauge? Yes, 18 gauge is green. 22 gauges. Yes, blue, and 24 gauges. Yellow, and then we have one more. 26 gauge, which is 26 gauges. Yes, it is violet or purple. Okay. So please remember this. These are the most basic questions. They have asked you from very basic questions like IV lines to very high-fi new questions like HFNC. But we have covered all of these in our classes. Okay. So remember, whatever the portion is limited, just keep attending all your classes and you're going to be and solve your tests, solve more questions. And that's the only way even in the NEET 2021 exam that you're going to do well. Okay. Next. Blue pipeline in OT is for which anesthetic gas? Oxygen, nitrous oxide, air, or vacuum? I think this question even came in the MDS exam. Those who were giving the dental exams. So I got this question from one of the students, Mansi. Okay. Okay, I can see here that most of you have answered this correctly. So yes, the nitrous oxide pipeline is blue in color. Now tell me, what is the color of the oxygen pipeline? They may ask you the next time, what is the color of the oxygen pipeline? Yes, so it is white in color and it has black stripes on it. Okay, it is similar to the Unacademy t-shirt. It is white in color. White and black is the color combination. Now remember, it is the same color combination for your oxygen cylinder. It is the whole cylinder, the body of the cylinder is black in color and the shoulder is white in color, just like the Unacademy t-shirt. Okay. Now, next one that we have over here, what is the color of the vacuum pipeline, guys? So easy way to remember your oxygen cylinder color, your Unacademy t-shirt, black body with white shoulder. Similarly, your pipeline is also the same color. You have alternate white and black stripes in it. Okay. Okay. Yes, absolutely correct. So this yellow colored pipeline that you can see over here is the vacuum pipeline. Okay. What is vacuum used for? It is used for suction of all your oropharyngeal secretions. All right. Now let's move on to our next question that had come. What is ideal CPR? Chest compressions 100 to 120, respiratory breaths 20 to 24, depth of 5 centimeter during chest compressions. Okay. Now A, B, C are correct. A, C are correct. Only A is correct. None are correct. So what is A, B, C over here? Okay. So I'll start the timer for you guys. Okay. So someone is saying there was also a chest recoil option. So what was the option over there? If you guys can tell me, then I can help you out with the completely correct answer in that case. Allow chest recoil. Allow for chest recoil is the option. Okay. Allow for adequate chest. So let's do marking the each and every option. So first one is chest compressions should be 100 to 120 for high quality CPR, ideal CPR or high quality CPR. Is that true or false, guys? So chest compressions 100 to 120 is true. Okay. That is true for high quality CPR. The next one, respiratory breaths between 20 to 24. So there was some confusion about this, about the respiratory breaths. Now I'll tell you, if we are talking about adults, they say that you should give one breath in every 5 to 6 seconds. Okay. So that comes to about 10 to 12 breaths per minute. Now this was what was followed till now. If you're giving respiratory breaths in pediatrics, as per the latest 2020 CPR guidelines, you should give one breath every 2 to 3 seconds. Okay. So this comes up to 20 to 30 breaths per minute. Now, if I was to answer this, I'm giving the INI-CET today and the CPR guidelines have just been released latest. I wouldn't go as per something which has just been released very, very latest, and unless they specifically mention in pediatric patients. Now, I've asked this from the other students. They had not mentioned about CPR in pediatrics. This was just a general question, high quality CPR. So you would go with this being the false option because your respiratory breaths should be one in every 5 to 6 seconds. One breath every 5 to 6 seconds. So it should be 10 to 12 breaths per minute. Okay. So 10 to 12 breaths per minute is there for high quality CPR. Now, the next thing, depth of 5 to 6 centimeters during chest compressions, that is also true. Your depth should be either 5 to 6 centimeters or it should be 1/3 of your anterior-posterior diameter. Okay. So they've given you 5 to 6 centimeters. So that is also true. And the last one was allow for adequate chest recoil, which I just got the option from you guys. So that is also absolutely true. You should allow for chest recoil. So there is only one false option over here about the respiratory breaths. It should be 10 to 12 per minute and not 20 to 24. The rest all assure high quality CPR. Okay, for all those who did not get this question correct, I highly recommend you to go through the old CPR as well as the new CPR guidelines. I have taken YouTube sessions about the same, so you can just go on YouTube, type Unacademy and my name, and you can see it there. Okay. All right, the next one. What is the use of this cart? I think there was a similar cart like this. This is the picture that I have visualized from what you guys said. So central line insertion, arterial line insertion, airway cart, or crash cart. Okay, so Krutika is asking, recoil should be, yes, of course you should allow for adequate chest recoil. And why do you want the chest recoil to happen? Is because you want the heart, when you pump the heart, you are pushing it, you're contracting the heart, so that is systole for the heart, so that the blood flows out of the left ventricle. When you allow adequate chest recoil, what are you allowing? You're allowing the diastole. So you're allowing all the venous return to come back to the heart. So it's absolutely important to allow for chest recoil so that the venous return comes back, fills the heart, and then you can give chest compression and the blood is pushed ahead in the next compression. Okay. So please remember that. Okay. Now, over here, someone had told me that there were laryngoscopes in the cart, and then there were tubes, and there was some syringe. Okay, so this I can show you guys. There is a syringe over here. What is it? It's basically for inflating the cuff. Okay, then the second, laryngoscopes, airways, oropharyngeal airways, and tubes. If they are present, then they are nothing but the airway cut. But be very, very sure that it's not crash cut. Okay, now this was not there in your options. So I have not, I have actually specifically put it because I wanted to discuss. Crash cart is something that we use in CPR, okay, in cardiopulmonary resuscitation. So in that also you have laryngoscope tubes, but along with that you will have a lot of drug ampules. So you'll have ampules of adrenaline, atropine, amiodarone. Then you will see that there are other things available like a central line, so that if you want to resuscitate the patient and give him drugs. So all those things will be there in crash cart. There will be an AMBU, there will be LMAs also. Okay, so that is how crash cart is different from airway cart. But this one over here is the airway cart, which had the laryngoscopes, tubes, plates, everything. Okay. Okay. Now, next, I just put this picture for you guys so that if they ask you any of these options in your exam, next exam, you should be able to answer. So this is your central line catheter. So if they give you a picture of this catheter, then you should know that this is a trolley for prepared for putting in a central line. Okay, so you can see this is the dilator. This is the triple lumen central line catheter. Triple lumen means it has 2 lumens. You can see here 1, 2, and 3. And then here the round thing is the guide wire. Then you have a needle for putting in your IJV or subclavian wherever you want to access the vein. And this is your syringe for aspirating blood. Okay, so this is your central line catheter. Now this over here is your arterial cannula, because one of the options was putting in an arterial line. So this is your arterial cannula. So you hit the artery with this needle, and then you, using the Seldinger technique, you put this arterial catheter above the needle. Okay, so that is how you secure your arterial cannula. And this, can anyone tell me what is this down here? Picture number 3. Does anyone know what is it? I'll zoom it and show you guys. Yes, Ashutosh is absolutely correct. We have discussed this again in our classes a lot. So this is an invasive arterial line transducer. Okay, so the above one is the cannula, but the below one is the transducer that you connect so that you get invasive arterial line blood pressure. Okay, remember this, and you can see that this is your arterial cannula that is attached at the end, and this entire thing is your transducer that you connect to get the invasive arterial line blood pressure. Okay. Okay. Now, next question was, you find a patient lying unconscious while jogging in the morning. What would you do? Again, I got just 3 options over here. If you guys remember the 4th option, please do let me know. So they had given the order as check carotid pulse, CPR, call for help, and shock if available. Then next is call for help, check pulse, do CPR, and C is observe. Okay, so I know there was a sequence, so can we guys discuss the sequence? Okay, someone wants me to add points regarding fiber optic bronchoscope. I will tell you about this. Okay, there was one option to leave the patient and there is one option to observe the patient. That you should definitely not do. So let's do one thing. Let's just quickly discuss if this is your BLS support. Okay, so if you have to, if you're just walking by from somewhere and you see someone lying unconscious, always the first thing will be call for help. Okay, because remember, you're not Superman, you're not Shaktiman, you can't manage everything on your own, so you should always call for help first. Now you can call for help, either just shout by for nearby help, or you can call for help using your mobile device. And if you have the option, call for help with AED. Tell them that when you're coming, get AED. Okay, then the next thing that you do is that you have to check both things simultaneously. One is the pulse of the patient for 10 seconds. You should not give more than 10 seconds, and if you're given an option to check a pulse, it should always be the central pulse. So it should be either your carotid using 3 fingers, or it should be your femoral pulse, because they are your central pulses. And along with that, check for respiration of the patient. Now here I have missed a point. Can anyone tell me what is absolutely important between call for help and check pulse and respiration? Yes, Shimon, absolutely correct. So Shimon is actually awake and all of you are in post-exam euphoria. Okay, so before checking for pulse and respiration, you have to check for responsiveness. So you have to check whether he's awake or not. You have to tap him on the shoulder and you have to say mama, chacha, whatever, try to wake up. If he's not responding, check for his pulse for 10 seconds and respiration. Simultaneously, this has to be checked. And if both of these are not happening, then you start CPR. Okay. Now, if he has a pulse is present, but respiration is absent or it is not good, in that case, you have to just give him one breath every 5 to 6 seconds. Okay. And every 2 minutes, you have to check his pulse. Now, during this time, if you feel that there is no pulse, then what you do is you start CPR. Okay. Now, over here, when you're checking the pulse and respiration, if pulse is okay and respiration is also okay, then what do? You just observe while help arrives. Okay. So that is how you manage a person who is lying unresponsive. Okay. And if they have given you the option, which I know that they haven't given you, then even before call for help, there is one more option which they have not given you in the exam, and that is you have to verify scene safety. Okay, so if he is lying in the middle of the road, please take him to the side of the road, otherwise a car will come and push both of you all away. Okay, and then you will need CPR. And I guess this was also one of the questions, but I'm not very sure, so I'm confirming from you guys. What is the correct concentration of adrenaline given through these routes? IM 1:10,000, IV 1:1 lakh, SC 1:2,000, epidural 1 is something like that. Okay, so I'm just starting the poll. So what you guys should do is just mark the correct option over here, and then I'll tell you what is the correct concentration of adrenaline through different routes. It was matched the following. Okay. So tell me, out of these, which do you think is the correct concentration? So this is for you guys to remember for next time. I'm putting the concentration. Okay. So if you're giving the patient IM intramuscular, you have to give 1:1,000. If you're giving IV, then you have to dilute it to 10 ml and give 1:10,000. If you're giving subcute, you have to give 1:1,000. If you're giving as an epidural test dose, you have to give it as 1:2 lakh. Okay, so these are your adrenaline concentrations that you guys need to remember. Okay, so we are done. Okay, for spinal anesthesia, you have to give 1:1 lakh. 1:1 lakh. And for epidural, we give only test dose. We don't put it as an epidural infusion. So that is 1:2 lakh. Okay. All right. So thank you so much for joining me today. For those who were attending my lectures regularly I'm really happy that you guys got some questions from there. I'm really glad to help you out. And also remember, guys, that you can always come onto this Telegram group, Ace NEET PG with Dr. Jhanvi. Here also we discuss many questions. Whatever classes I put, I share it with you guys over there. You can just click on the link and join the class. And obviously, better than that, you guys should join the Unacademy platform, where all the teachers have been discussing similar questions with you guys. And the code for Unacademy platform is jhanvi.s.bajaj, and you get a 10% off when you join using this code. Okay, Shimon wants to say how to identify endoscope versus fiber optic bronchoscope. Okay, so basically they both look very similar, but endoscope का जो ये scope है ना, which has the fibers, it's way more thicker as compared to a fiber optic bronchoscope. In a fiber optic bronchoscope, it's very thin, like 1 second. So it's as thin as this. Okay, as thin as this wire, your fiber optic bronchoscope. The आगे का scope, not the handle part which has all the buttons, but the आगे का scope. Okay, and the endoscope that you have is quite thick. It's much thicker than this. Maybe it's 4 times the thickness of what this is. All upper GI endoscopes were given. And what did they want you to discuss? I mean, what did they want you to mark? Which one is a fiber optic bronchoscope or what? Upper GI bleed. Acha, management of UGI bleed. Okay. All right. So these were the anesthesia questions, and I guess there were also a couple of COVID questions. If I remember, someone has said that there was a question about what is the pathology of COVID. So that is diffuse alveolar damage. If I'm not wrong, those were the options. Anyone? Yeah. So diffuse alveolar damage was the option for that. And then there was also something about a drug which is useful in COVID or not useful in COVID, remdesivir, favipiravir, dexamethasone. There was something like that, but I didn't get the correct options. So come on to the Telegram group, and I'll make sure that that question is also discussed with you guys. But please make sure you share this PPT also, or this class also, with the rest of your friends. They watch it at least once, so that you know that if similar questions come for your exam, then what you can do is directly start analyzing them and preparing for the next exam. Okay, before I leave, I want to tell you guys, all of you have worked very hard. Even if your exam didn't go well today, even if you made silly mistakes, remember the main exam is your NEET PG 2021 exam. So this was just a stepping stone to that exam. Don't lose hope. Continue studying. Today take off, tomorrow take off, and then from day after tomorrow, I want each and every one of you to make a schedule. Okay, and in this schedule, this schedule has to be till NEET PG 2021, so that you revise the whole thing again. You have your matter, you have studied it many times. It's only revision which matters, and a presence of mind during the exam. Keep attending more classes, answering more questions, so that you're used to answering those. Okay. Meghna saying remdesivir, favipiravir, steroids, LMWH, which one is not useful? In fact, actually, today guidelines have been released by the Indian, I'm not sure which medical association or something, which says that remdesivir is not useful anymore in the treatment of COVID. So that is something which is a topic which is very, very which is changing all the time. But steroids and low molecular weight heparin definitely are still a part of the treatment. It is between favipiravir and remdesivir, but if you ask me, as per the latest, it is remdesivir. So here I'll share it with you guys on Telegram. So it says that WHO suspends remdesivir from list of medicines for treatment of COVID. So that could be the answer, but this is something which has come today. Okay. All right. Thank you for joining me today, guys. And